name's Jeff Race. I'm a respiratory care senior student over at Hudson Valley Community College. I'm just going to go over one of the ventilators that you may see in your profession in the home care setting. This right here is the Viasys LTV 1200. This is a ventilator you may see in your profession in the home care setting. It's very portable, and the one specific thing I like about this ventilator is that you can have portable batteries, and it's just very small and maneuverable. Something like the ventilator behind me is very big and bulky, and this is something you see in the hospital setting. This isn't something you will see in the home care setting because it's so big. So the good thing about this, it's nice and small. Here on the screen, on the top, this little bar right here is a little box where it'll tell you what measurements the ventilator is obtaining. It'll also tell you and notify you of any alarms that are sounding. Right here, you have the breathing rate, you have tidal volume, pressure control, inspiratory time, pressure support, your O2%, your sensitivity levels, and over here, this red box is your alarm settings. Your alarm settings is something you may alter, and the alarm settings is something that's important for patient safety. Down here, you have the PEEP setting, and then down here are just various options you may need to alter. This ventilator specifically has an internal battery that lasts about 1 hour. There is an option to have external batteries which last up to 6 hours. You can buy different batteries for different times. One of the important things you need to understand is your alarms. Anytime this alarms, you want to be aware of what's going on. So the number one thing is to look right here. And on top of looking here, you want to look at your patient. Your patient is the most important thing. You know, your ventilator is a machine, your patient is a living human being. So you always want to be aware that there's a patient connected on the other end of this ventilator. One thing that you may experience in the home care setting is a power outage. Like I said, this has got a 1 hour battery, so you will have up to 1 hour to really, figure out what's going on. But we'll show you what happens in a power outage briefly, so you can unplug that. What's going to happen? Your alarms are going to go off. Right here it does say power lost, okay? But if you notice, the ventilator is still functioning. So all I'm going to do is hit silence. So the ventilator is still functioning, your patient is still receiving mechanical ventilation, but it's just telling you that it has lost power. So right now you do have a safety factor. You do have about an hour until this ventilator will run out of battery. And now that that's plugged in, I'm just going to silence it and it's back to normal. The other thing is, if for some reason you do go an hour and you have no more power, no more battery left, this is an ambu bag. This is very important in anybody that has an artificial airway, whether it be an endotracheal tube or a trach. This is gold. Anytime the ventilator stops working, or anytime any of your alarms are going off and you can't figure out what's causing that, the key is manual resuscitation. You can apply it to a trach, an endotracheal tube, and you're just going to manually bag them. This ambu bag has a PEEP valve, so if this person is on a PEEP of above 5, anything 5 or more, you need to put a PEEP valve on your bag, or at least it's recommended. You can put this, like I said, endotracheal tube or a trach, and you also have a mask. You always want to have a mask present, even if they're trached. It's just something that you should always have present in case there's something wrong. If they have an endotracheal tube and something is wrong with that endotracheal tube, or it comes out or it's occluded, and you need to have this present in case that airway is compromised. That's it. Okay, so here we have our ambu bag, and we're going to go over briefly some techniques on how to use it on someone who's trached and someone who's not trached. Here's our patient right here who is trached. We're going to pretend for this matter that he's not trached at this time. For anyone who's not trached who needs resuscitation, we're going to have our mask here. We're going to form a C with our index and thumb. Right here we're going to have an E with our other 3 fingers. We're going to place the mask firmly, our 3 fingers along the bridge of the chin. We're going to perform a head tilt chin lift on someone who is atraumatic or no spinal injury. If you have someone who has a suspected spinal injury, we're going to do a jaw thrust maneuver. Then you're just going to apply pressure to your bag until you have positive chest rise. And now, if you do have someone who is trached, it's pretty simple. You're just going to apply the bag right to the trach, and same thing, apply pressure till you have positive chest rise, and you can confirm lung sounds. Okay, so now we're going to go over trach care. It's going to be a little abbreviated, so I'll try my best to describe everything that I'm doing. So basically what we're going to do is pretend that my hands are sterile. We have our sterile field here laid out on the table. The one thing to keep in mind is we need to keep one hand sterile and one hand clean. So for this matter, I'm going to have my right hand as my clean hand, which will be cleaning the patient's trach, and my left hand will remain sterile. So what I want to try to do is not touch anything with this hand because I want to keep it sterile. So what we're going to do first is right here we have our trach. We're going to remove the gauze. Now the one thing you want to be sure not to do is remove this trach tie. You want to keep the trach tie on at all times because you do not want this coming out of place. Now that we have the gauze out of our way, we're going to take... Now this is not going to be sterile now that I've touched it, so that's okay. We're going to take our Q-tip here. In this small part right here, we're going to have hydrogen peroxide and then normal saline solution. We're going to start with our Q-tips into the hydrogen peroxide, and then you're going to sweep from the inside out on each of the four corners. So I'm going to do inside and out with this one. I'm going to toss my Q-tip and get a brand new one. Same thing into the hydrogen peroxide. I'm going to go on this side, in and out. And then same thing, get a new Q-tip into the hydrogen peroxide, and you're going to go down and out. The point of this is when you're coming down like this, you want to come out because you don't want to move any of that dirt or any bacteria into the trach. So again, getting a new one, hydrogen peroxide. I'm going to go on this side, in the trach and out, and you're just going to do that all around. When you're done with that, you want to do the same thing with normal saline to rinse away the hydrogen peroxide. You're going to do the same thing with the Q-tips, in and out and around the entire trach, making sure that you always get a new Q-tip. After that, what we're going to do is use our gauze. We're going to do pretty much the same thing, this time with the gauze. We're going to dip into our hydrogen peroxide, and we're going to do the same thing. Sweep away, get a new piece of gauze into the hydrogen peroxide, and down under here, sweep away, and same thing 2 more times with our hydrogen peroxide on this side and this side. After that, we're going to do the same thing, however we're going to use normal saline solution, so that way we can clean away the hydrogen peroxide. So when we're done with that, what we're going to do is we're going to change the inner cannula of the trach. Now, this is the part that needs to be sterile. This hand right here does not need to be sterile because I'm taking this one away. However, when I do get the clean one, my hand wants to be sterile when I put that in place. So this is going to be our old one. All I'm going to do is simply grasp the sides here, unclick it, and I'm taking it out, and I set it aside. So then I'm going to take my sterile hand, pretending that this is sterile. I'm going to take this and put it in the trach, and then you latch it on right like that. Now my hands don't need to be sterile. I'm going to get my new, actually I'm going to get that after. What we're going to do is we're going to change this. You do always want to make sure you hold very firmly onto the trach so you don't lose it. So you can take this off right here. Now, typically you would have another one of these set aside, so you can then attach it here and then feed it around the other side when you take this side off. But for the purposes of this, I don't have a second one, so we'll just use this one. So pretending that I had changed it. After we change the trach tie and it's nice and firm, you want to normally allow 2 fingers width apart. After that's done, we have our clean gauze that can go around the trach, and you're just going to guide it underneath. And that's it. It's very abbreviated.